The 8th Bioceuticals Research Symposium is going digital and will take place over 4 weekends from the 6th to the 28th of June 2020. For more information and to register your place, go to bioceuticals.com.au and click on the Education tab. This is FX Medicine. I'm Andrew Whitfield Cook, and this is welcome to part 2 of Influencing Immunity with Amie Skilton. Now, in part 1, we discussed some of the nutrients that were useful in combating infections, mainly viral, but obviously also bacterial. And obviously, this is a very complex issue, so there's only so much that we can cover. But today we'll be discussing some of the herbal options we have at our disposal. So, Amie, welcome back to FX Medicine. How are you?
Thank you so much, Andrew, for having me back. I'm so excited to be
Sorry,
having this conversation with you again. You know, we got through so much in part 1, but there's just still so much to share. So
yeah, and obviously this is an extremely complex issue. Like it's so hard to go into the biochemistry that happens in our immune system, which often gets oversimplified. You know, we talk about macrophages, we don't talk about the influences upon the macrophage. We don't talk about the various white blood cells. What about the CD4, CD8, the Tregs, all of that sort of So there's so much to cover. You can't do it in one podcast, but we're going to give hopefully the practitioners out there some options, some herbal options, and give them maybe some things to think about, especially in the current situation that we have it affecting us all. So
yes, absolutely.
So where should we start? How about we start with the concept of stimulating the immune system versus modulating the immune system?
Yes, that was a question that got submitted for the podcast last time, and we didn't end up getting to it. So I think it's worth having that conversation now, especially because there's a lot of misinformation going around at the moment as well. I've seen actually medical doctors suggesting that stimulating the immune system is equivalent to triggering an autoimmune disease. Now, as you said, it's very difficult to explain things succinctly in 5 seconds, but that is really a blatantly incorrect statement. We know we can upregulate and downregulate immune function that is completely independent of the target of the immune function, whereas an autoimmune condition, of course, is when your immune system fails to recognize the tissue that is yours and begins to attack it. Now, if you have an autoimmune condition and you're in a flare-up, then herbs or pharmaceutical medications that stimulate white blood cell activity might not be the right choice for you in that moment because you don't want to speed up the destruction of your own tissues. However, when you're fighting an infection, and obviously that aside, accelerating the rate at which your immune system can get on top of an infection is, of course, a good idea most of the time. Having said that, there are different ways of how you can, I guess, define stimulation of the immune system. And we did mention it in the context of vitamin C because vitamin C increases white blood cell activity. Having said that, I feel like, you know, maybe what you're really doing is providing more and more of the fuel that they need to do their job more and more efficiently. Is that really stimulating them, or are you ultimately just optimizing, like,
or are
helping
you just cleaning up debris? Yeah.
Totally. So it's tricky to sort of peg that down in black and white. But if we use the term increases white blood cell activity as a measure of stimulating the immune system, then yes, we can achieve that with a number of different herbs, which of course is just one part of tackling an infection. But that's what makes Echinacea so popular, because that is one of the properties that it has.
Yeah. As we said, the immune system is so complex. Indeed, there was a beautiful thing that I saw the other day, and it just went into just some of the complexities of our immune system, including just the CD sets. I mean, when you look at the CD sets and therefore what interleukin involvement is involved, I mean, it's
wild.
It's
I know, it's wild.
far more than we are exposed to by many companies, and just this simplistic thing. In fact, even the TH1 TH2 seesaw, that's so 80s or 90s.
Yeah.
That was by Dunstan, and it wasn't. It was basically, the limitation was due to the machinery, if you like, the equipment that he had to assay things. We indeed now know that that seesaw is basically like a bendy seesaw with some roundabouts going in the background as well. You can have TH1, TH2 comorbidities at the same time. You can also have this sort of thing going on.
Well, I mean, ultimately, when it comes down to that, you've got naive T cells that are being directed to, you've got TH1, 2, 7, 22, 17, TH9, and it's not necessarily that, say, a TH2 or TH1 response at the start is inappropriate either. However, when there's a loss of the promotion of regulatory T cells, which I like to call the peacekeepers of the immune system, you can't switch off these immune responses, and that's when they can become aberrant and cause problems for people. And this, everybody, is why that when you're looking at using herbal medicine to support your immune system, it's important to see someone who's qualified in herbal medicine, because they understand how to apply it and what's happening underneath the hood inside your body.
Yeah, and indeed, this is why that naturopathic idiom about treating the gut first, treat the gut, it still stands. Indeed,
it does.
Even with regards to SARS-CoV-2, it is a gut-based disease in many instances. I mean, we're seeing these incredible diversity of symptoms now, including rashes and vasculitis and all of that sort of thing. But importantly, in so many people, it is gastrointestinal symptoms which present first.
Yes. And we know, of course, when you've got that inflammation presenting at the gut, we start to see a degradation of the integrity of that tissue and translocation of LPS and other endotoxins into the bloodstream, which, of course, is partly responsible for the systemic effects that occur in the later stages of that condition, and can, of course, happen in major infections of any other nature as well. So that's probably, a fourth podcast that we need to talk about how to drive regulatory T cells and keep inflammation under control. But having said all of that, if your body can get on top of an infection quickly, you then really drive down the risk of that perpetual inflammation starting to cause collateral damage in the body, which is why I think, you really need to act at the first sign of anything and really take care of yourself at the first moment where you think, I think I might be coming down with something. And that's where I think herbs are most effective too. As soon as you intervene at the first sign of symptoms, you can sometimes avoid getting sick in the sense of being so unwell you can't go to work or function as a human being. And there's lots to choose from, isn't there?
Yeah, absolutely. I mean, I totally subscribe to everybody seeing somebody that they trust with regards to the choices, the appropriate choices for your particular condition. But I do subscribe to having a first aid kit in the background, and the Echinacea being the poster child of immunity, if you like, really is one of those primary herbs that I just always use. Indeed, I very often use Echinacea on its own straight off the bat when I get that first weird, nasopharyngeal irritation, like that feeling, and I hammer it. I really do hammer it. Now, obviously, that's not without its caveats. If you have an allergy to the daisy family, or indeed, you have a particular sensitivity to the particular tingly, burny sensation from the alkylamides from Echinacea, then obviously you've got to watch that, and I'd choose some other herbs. So over to you. What sort of other herbs have we got?
Well, so I'm in the fan club of Echinacea too, and I do want to chat about why it is Western herbal medicine's go-to. But we've just had a comment pop up from Graham. Thanks,
Yes.
Graham. Graham is
Very good question.
yeah, saying rather than looking at stimulating the immune system when infection occurs, wouldn't it be better to make sure it's supported long term? Absolutely. And I'm pretty sure, Graham, you were in the earlier podcast where we were talking about vitamin D, vitamin C, vitamin A, zinc, selenium, and supporting your immune system by making sure it's nutritionally replete, as well as avoiding the things that are going to suppress its function, are 100% something people should really be looking at daily as a daily support. But having said that, you know, I, as a practitioner of almost 20 years, I have got a wintertime protocol, which I'm employing right now for obvious reasons, but that doesn't make me bulletproof. And depending on things like my stress levels or the virulence of whatever pathogens going around, there are, of course, other things you can have in your cupboard just in case, which is exactly what I've done. I have, while everyone was pantry hoarding toilet paper, I was buying up all the respiratory tract herbal tinctures, and we'll talk about those today. But I was ready, and to be honest, I actually did go through symptoms according to the timeline of the virus that's currently going around, and I acted in accordance to that, and was very grateful to have these, you know, next level tools to call on. Now, the reason why Echinacea is such a popular herb in Western herbal medicine, it is really the first thing that herbalists will often reach for when your body is fighting off infection. And there are, as you mentioned, there's a number of different components that we now understand the mechanisms of action for how it works. But ultimately, we know that Echinacea is very high in natural antioxidants, and free radical damage is a serious secondary issue when it comes to immune responses. We also know some of those compounds inside the herb actually boost white blood cell activity, meaning that they work to accelerate or support our immune system to work faster to fight off infection. And so it's commonly utilized for respiratory tract infections, but it's also commonly called on for infections of any nature. And in fact, the Native Americans in the US used it for snake bite as well to support the immune system. Well, look, if I was bitten by a rattlesnake, I'd be calling on more than Echinacea, but I do love that they used that traditionally with good results, and I would probably chuck that down too, quite honestly, if I was bitten by a snake.
I think the scenario there is, what else did they have? You know, when you've got nothing, something's better than nothing. So if you think historically, more people died who took Echinacea than those who didn't. So that would have been why they chose that sort of thing. But,
for sure.
but in our modern era, get thee to hell to hospital.
Well, all right. Well, let's talk about respiratory tract infections, though, because we're certainly not recommending Echinacea if you get bitten by a snake. I've got a list here of some of the key studies that have been done on Echinacea as they pertain to respiratory tract infections. You know, we're approaching June very quickly, so it's a great time to be talking about this. So in a large randomized double-blind placebo-controlled trial, there were 755 people who were administered either placebo or Echinacea. And over this 4-month period, those that took the Echinacea had a 53% reduction in days experiencing symptoms of a respiratory tract infection. Now, as a medical herbalist, I'm not a big fan of giving Echinacea as an ongoing herbal medicine. It's almost like flogging a horse. Eventually, it's going to get a little tired. So
why would you need to?
Yeah, so it's my preference to sort of save it for in times of infection. But I will say, if you're in an occupation that is being exposed to sick people a lot, you might work in retail like grocery, you might be a medical professional seeing clients in person, you might be a school teacher, or, you know, even someone who, for example, a bus driver where you've got lots of people coming on and off the bus and you're being exposed, there could be an argument there for low dose Echinacea reducing your risk. And I do want to say that in people who took Echinacea like that over an 8-week period, it reduced their sick days by 30%. So there is evidence for its use in that way. But more specifically, when it comes to being ill, people recover twice as fast. They get better much quicker. And I also want to say there was a pilot investigation in using Echinacea in over 1,500 people who were given either the flu vaccine, Echinacea, or a combination of both. And looking at both symptoms and blood work, Echinacea was more effective than the flu vaccine or the combo at reducing the illness incidence and length of illness. In fact, it was significantly so. And so there is evidence for its use like that too. Again, I would prefer that people really focus on the nutrients so the immune system can do the job it's programmed to do. But like you, I would always have a bottle in the cupboard just in case at that first sign of an itchy nose or a sore throat.
Yeah, I think, I mean, the research around Echinacea is very interesting, very controversial, and certainly not without its issues. But when you look deeper into those people who have a respiratory infection, an URTI, an upper respiratory tract infection, you know, there's both positive and negative papers on Echinacea. It's not just the dry, and it's not just the dry root, because some of those studies are negative. Indeed, one of the favourite products on the market had a negative trial in airline staff. Now, let's think about this. When we talked, mentioning Graham's question about nourishing the immune system, these people are under constant stress. Physical, emotional, circadian stress. So
100%. Not to mention the radiation.
That's right. So you can't expect particularly a single herb, to do the job of eradicating this virus, which, by the way, mutates very quickly, without looking after and nourishing the body's innate defense systems, i.e. rest, you know, soups, nutrients, nourishment, you know, warmth, all of that sort of thing. So it's just, we've got to look further than what the study says. And there is nothing that is so strong that it can outweigh these very basic tenets of nursing your body back to health.
Not to mention that herbal medicine is not to be administered in the same way, generally speaking, like a pharmaceutical medicine would. And as Sharon's pointed out in the chat, you know, it is not that common to administer single herbs for the management of something like this. And you would carefully choose other immune support herbs, things that directly supported the symptoms that that person might be experiencing and their own unique biochemistry. So, which is why you see Echinacea usually paired up or in a trio or even in a full herbal medicine combination with other plant medicines as well.
All right, so let's go on to some of those.
Yes.
Another one. I've got to pick on this olive leaf.
So, all right, well, let's talk about olive leaf. Olive leaf is one that I would say a lot of people walk into pharmacies and health stores asking for. And whenever they, you know, are experiencing a cold or maybe something a little more aggressive than that. And olive leaf is an incredibly powerful anti-inflammatory. And one of the reasons we feel so terrible when we're fighting off an infection is because of the inflammatory cytokines our own immune system is producing. And these can cross the blood-brain barrier, meaning it affects us not just physically, but mentally and emotionally as well. And they're not fun. They're certainly not pleasant. And they are part of nature's way of bringing attention to your predicament so that you do something about it, and B, the impact that they have on our brain makes us antisocial, moody, sensitive to light and sound sometimes, tired, and really just generally unenthused with life, which is the whole point, because it drives us back to our bed, keeps us away from other people and making them sick, and actually forces us to take time out and recover. So olive leaf is, you know, loved and adored because it makes people feel better quicker, and I think there's a real place for that. I don't love the suppressing of symptoms to the point where you operate like nothing's wrong, because that will defeat the purpose of them entirely. But olive leaf does have a role to play there. There is something else about olive leaf, though, that I particularly like. Now, what's so special about 2020 and being a herbalist in this time is we're getting more and more sensitive instruments, more and more advances in scientific analysis, and we're beginning to understand more and more on a biochemistry level of how these herbs do the job that they do. And there is a very interesting mechanism that is attributed to the oleuropein inside olive leaf as an actual antiviral itself. So oleuropein is a compound found inside olive leaf extract, although it's a very, very small amount. And so if you're looking for this mechanism of action, I would suggest you look for an olive leaf that has been standardized to oleuropein. Now, oleuropein itself is not in and of itself antiviral. However, when it's taken up into our cells, which is exactly where viruses hide, up in the nucleus, there's an enzyme in our cell that converts that compound into calcium alanolate and alanoic acid, which becomes an antiviral compound inside the cell where the virus actually is. And I describe it to my clients like pulling the pin out of a hand grenade. It's almost a Trojan horse, if you like, getting into the cell and acting upon the virus inside there. And so I think as we begin to understand that more and at what level it has that effect, it's going to really support its use for viral infections, and I guess really continue to champion it for the use in respiratory tract infections, for sure.
So one of the things that I learned that was really interesting, this was from Ian Breakspeare's research, really interesting stuff, was that he assayed products in the retail arena and products in the practitioner arena. And Ian, forgive me if I get this wrong, but what happens is when olive leaf is aged, or the more it's aged, the more conversion you get to this compound called hydroxytyrosol. And he found higher amounts in the practitioner products available on the Australian market than the retail. Now, here's the question. Is the fresh olive leaf more potent than the aged? Is higher hydroxytyrosol bad? I don't know the answer to that question, but it was really an interesting point that came out of it. I mean, to me, what's telling is we certainly need to look into the complexity of the herbs. It's not down to one standardized component. We really need to refresh our memory that herbs are not drugs. If you want to go drugs, use drugs.
Yeah, I agree. I mean, it's a real balancing act as a practitioner, isn't it? We've got hundreds, sometimes thousands of years of that herbal medicine being used in a particular way, prepared in a particular way. And, that's a really nice lineage to rest upon and rely upon. But I also embrace that in this day and age, we can look inside a plant and really identify all of its incredible components and experiment and actually see what they do. And in some cases, we may even find better ways of preparing, growing, harvesting, producing, administering herbal medicines that make them even more powerful. And that's really exciting. But I think what some people forget is science doesn't dictate what is so. It seeks to explain what is so. And so whilst I'm really enjoying watching science explain what we already know to be true about herbal medicines over and over again. And it's really exciting to be able to actually understand the plant a bit deeper and the way it works with our own biochemistry. But just because a study hasn't been done on this or we don't quite understand that doesn't mean it isn't the case until science says so. And so I think in practice, you have to really work on your own, what we know traditionally, what science is informing us or sharing with us, what we're seeing in practice and how our patients are responding, and just really using our own knowledge as well to be able to really personalize prescriptions for people.
One thing that I just thought of with regards to olive leaf, and it certainly suits the scenario, and I'm not saying that this is a treatment. There is no evidence on this treatment, but I think isn't it very interesting that olive leaf works mainly as an antihypertensive? What's
Yes.
the major presenting comorbidity with the current immune issue worldwide?
Yeah, 100%. Yep. Very interesting.
I wonder how it works. I wonder if it's
Yeah,
got
well,
anything to do with ACE2.
yeah, that's a worthy line of investigation. And I think given that what's going around at the moment is quite complex, there's a lot that has yet to be explained because everyone's in crisis mode trying to stop people dying. But those are the questions that need to be asked when we have got the time and the space to actually take a look at those mechanisms. And I think that's a very worthy line of investigation. The other thing I want to share about olive leaf is it's also supportive for fever. It's antipyretic. And so that's also an important consideration if you're choosing to include it in a herbal formula for somebody as well.
Okay, so we're going to be talking about thyme a little bit later on. And so when we're talking about combining these herbs, one's an antipyretic and thyme is used to enhance sweating. How do we modulate that? Let's bring it up now.
Well, so from a Western herbal medicine perspective, there isn't a clash there using those two herbs. Ultimately,
I guess not,
those two herbs are providing lots of different properties and ultimately supporting the immune system to do its job. And from a naturopathic point of view, we don't consider fever to be a problem or something that should be immediately addressed and shifted. Now, we know obviously dehydration is a thing that needs to be managed. We also know that the comfort of the patient is incredibly important. And so modulating that for patient comfort is also really important. And of course, prolonged, protracted, and very high fevers can bring some complications with it as well. So it does need to be managed very carefully. But the increase in temperature increases the immune system activity. It's a way of actually driving up immune function and your body trying to accelerate the rate at which it gets on top of this infection. So removing it is counterproductive. Having said that, in order to keep the body comfortable, diaphoretics that help with sweating to actually maintain that fine balance between, I guess, for want of a better term, a healthy fever versus an unhealthy fever, is a way of allowing the body to keep getting on with its job without too much interference, but keeping the patient more comfortable. And certainly if someone's presenting with a fever and they're feeling very cold, they're shivering, very uncomfortable, then, you know, there are other obviously recommendations you can make too, but herbs that address that are certainly important to include in the formulation as well.
You know, really interesting when you consider these points of management. And it's really interesting when we get caught up in excitement about something and we forget where it originated from. And in all cases, if you think about diaphoretics, how do you manage a fever? Then diaphoretics are useful, but obviously that's losing fluid. So hydration.
Sure.
You go back to these really basic 10 A's, you know, hydration, rest, avoiding the trigger,
It's not glamorous. And I think, you know, it doesn't have the same glamour as a fancy pharmaceutical drug with a, powerful instrument with a single action that is just like flipping a switch. It also requires more effort than popping a pill. You know, you've got to line yourself up with fluids, electrolytes. You're going to be sweating away, which might mean changing the sheets and including a waterproof, mattress cover for the time being. And it means maybe a few days at home feeling pretty ordinary or less than ordinary. And we live in a society in a time where, the badge of busy is something people still lord over each other. And that is a real problem because it doesn't suit our physiology.
No, that's right.
I'm just going to answer a question here. Sharon's asked about high temperature in children, particularly young children.
Yes, absolutely.
Now, children, what I know to be true is children can go down with infection very, very fast. They can also recover a lot quicker than adults, which means they have to be watched much more closely by, their parents or their caregivers in conjunction with whoever's providing the medical care. But it's really old-fashioned and not in line with the evidence to treat a fever in a child with something like paracetamol. And in fact, finally allopathy are catching up. I lectured at a conference for one of the large pharmacy chains in February, and they were specifically saying, we do not recommend you give baby pharmaceuticals or child pharmaceuticals to lower a fever, except in extreme cases. The evidence is not there. And in fact, what we also know to be true is that in doing so, you disable a key arm of their immune system by reducing their glutathione status, which is actually harmful. Now, obviously, a clinician always has to make the right call for the child that they're treating. However, more often than not, the evidence does not support that as a mode of action. And in fact, it can be harmful. And in naturopathic medicine, the first rule is do no harm. And so it's not something that we recommend. Yes, monitor it very tightly. And some of the key recommendations around what way you choose is to look at the child. Now, it's normal for a human, big or small, to go off their food when they are feeling unwell. That's a way of the body conserving energy and taking pressure off the gut and the immune system down there to deal with what's going on. It's normal to feel more tired and be resting more. But the key in children is to look for their responsiveness. Are they still alert? Are they still engaged? If they're starting to look, obviously dehydration in children is probably the biggest risk, to be honest. So making them electrolyte-based ice blocks or warm broths if they're looking for warmer fluids, and monitoring them closely is key. But if they start to get listless and less responsive, their consciousness level starts to be looking like they're sort of heading on the way out, that's when you need to act. But outside of that, the evidence is not there to support the administration of pharmaceuticals for bringing down fever. And if in the event you have to do that, sorry to cut you off, Andrew, a little roll here, but give glutathione. It doesn't mean, it's you don't have, it's not a hard and fast rule not to do it either. If you feel as a clinician or as a parent that your child best, if you're watching them and you don't like how things look and you feel like that is the best course of action, just know you can shore up the, I suppose, negative impact that it's having by giving something like glutathione or N-acetylcysteine to just balance out the collateral damage, if you like. Or
indeed in a child, whey. I mean, if you give good whey, undenatured whey that still has the alpha-lactalbumins and the gamma globulins, things like that intact, then that has been shown to increase glutathione. And so if you think about a food that can be used with kids that they will take because it tastes reasonably nice, whey. And you can get some beautifully formulated wheys out there that aren't sweetened with nasty, so just be careful about that. The other thing is, of course, with temperature, I mean, I'm not a fan of not bringing down a temperature. I'm a fan of managing a temperature. But what's interesting to me is that I was reading a paper just the other day about this, and it was, what do medical professionals, including specialists and GPs, feel about temperature? And a lot of them actually thought unduly that it had dire consequences, whereas what's been shown is that the vast majority of kids, even if they fit, don't have long-lasting problems with that. Having said that, it would be an extremely scary thing to witness, particularly if you're a parent. I'm of a parental opinion to manage the fever, and as you say, hydration. Interestingly, sitting a child in a hot bath to bring out erythema I found very useful as a parent. And indeed, when the temperature was run away, our kids hated this, but we did it. But what we did is we put them into a lovely hot bath, not too hot, but a warm bath, very warm. And then we took them out and put them in front of a fan and held them, and they screamed. They did not like it, but boy, did it drop that fever. Now, I take your point. I totally take your point about managing a fever and not suppressing a fever. I'm well versed from this naturopath that used to, as you say, put a plastic mat down on his bed and manage the sweating of his fever with adequate hydration and things like that. But that is somebody who knows what to do when things occur, not for the lay person. So I defer to what field practitioner says.
Yeah, and it also depends on, you know, does the child have other health conditions that you might need to be mindful of? How equipped does the parent appear to be to manage it? The stress of a parent is you know, definitely something that also needs managing, and no one wants their child to have a fit. So if you can avoid it, great. But it is nice that parents know that for the most part, it doesn't actually end up causing any long-term challenges. There's a question here from Helene about glutathione. Would you include it in the immune program? There's a real balancing act when it comes to recommending nutrients and herbs and other interventions. And you know, not many people have an unlimited financial budget. And, you know, I've never met a supplement I didn't love, but I also have a limit on how many things I'm willing to swallow in a day. And so you've got to sort of draw the line and think, right, what are my primary recommendations? What are my secondary recommendations? What are my tertiary recommendations? And if I was treating, say, an adult for, you know, common wintertime allergy, if they weren't already on a nutrient protocol of vitamin A, D, C, zinc, selenium, that would be the first thing that I would look at. And then I would look at a herbal mixture specific to them. Glutathione, I would love to put that in there too, but it's not often something I include in that initial recommendation because it's just another thing. Now, if you've done... well, yeah, that doesn't help. Now, I actually have a genetic polymorphism that impacts my ability to produce glutathione, and that means I'm much more vulnerable to ending up with not enough in my system. And so that is something, liposomal glutathione, I always have it in my fridge. And if I knew that about the person that I was treating, maybe I would prioritize glutathione a bit more. But it really comes down to the individual, and it isn't often something that I would include. Now, if it was for a child, and let's say I'd been treating them for a while, and I knew that whenever they got a cold or some virus, that they always had a very high temperature, maybe they'd fitted in the past, then yes, this is something I would include. And for the family's sake, it might be something I would say, all right, well then, you know, if you notice that get to this point, or you notice the child is starting to fade away a little bit in terms of energy and vitality, then you can use something to address the fever and use this as well. So it really does depend on the person you're caring for and a number of factors. But if you have got the budget for it and you're happy to take anything and everything, yes, I would include that in your protocol.
My opinion, because of taste and because I'm a male wimp. Why?
Use whey or use a capsule, or you know, there's lots of actually
adults take what let's move on, Amie, because again we're going to run out of time and we've gotten back onto nutrients. So more herbs. Andrographis. Now Andrographis, I remember, reared its head and sort of became popular when I was in practice, and I was extremely hesitant, I must say, to embrace Andrographis. And I still use it with certain, not hesitations, but only in certain instances. And the reason is because of its common name. So let's talk about Andrographis for a tick.
Yes. So when it comes to herbs, just like with pharmaceutical medications, you've got different safety profiles, you've got different strengths and activity levels. And whilst Andrographis doesn't have a narrow therapeutic index like something like poke root does, for example, when you look at it in the context of a traditional Chinese medicine model, it is an extreme herb. We were talking earlier and I said it's like the Mike Tyson of respiratory tract herbs. It is a heavy, heavy hitter. And anytime you choose to employ a herb that has very powerful activity, and in this case, it sits on the extreme of the yang scale in traditional Chinese medicine, and it's extremely bitter. The more away from the center of that model you get, the more it has the potential to unbalance somebody. And I know that sounds very kind of esoteric, but we're going somewhere with this. And where I'm going with that is whenever you're looking at herbs that have a very aggressive action, the risk for unusual responses starts to increase quite rapidly. And because Andrographis has got very solid evidence and solid use, it's called Indian Echinacea, by the way, for respiratory tract infections, it's very popular. And for the people that it suits, they love it. And, you know, since it burst onto the scene since 2006, there's been, you know, lots of celebrities that tout its benefits, and the people who love it are just like, you know, president of the VIP club. But there are some people that it has an undesirable response in. And I do want to talk about how useful it is for upper respiratory tract infections. But before we dive into that, I just want to warn people that it just doesn't always suit everyone. Now, number one, because it is an extremely bitter herb, it has an aggressive stimulating effect on our bitter receptors. And as a result, it can change the way things taste and therefore also smell. And for some people, everything just tastes like dirt, which is not fun. It's not fun. And when things don't smell and taste right, it can be very distressing. And so for anyone who experiences that response to Andrographis, stop taking it immediately. And this is not the herb for you next time you want to tackle a respiratory tract infection for yourself. There's also an even smaller subset of people who are allergic to it. And can experience allergic. Yeah. What have you seen?
Oh, well, it was actually a friend of mine who, I'll try and simplify the story, but it was the first, it wasn't her, it was a colleague of hers. First time they took something with Andrographis in it, they had a slight wheezing, and quizzically, this certain person took it again. Oh. Even though this friend of mine said, that's not for you.
Don't do this.
Yeah, so it was, I mean, anyway. But this friend of mine said, this is not for you, don't take it. And this other person took it again and ended up in hospital.
Yeah, look, you can be allergic to anything, right? Skincare products, foods, herbal medicines, pharmaceutical medications, things like latex found in, you know, Band-Aids, for instance. And so if you're taking it for the first time, in fact, sometimes it doesn't always happen the first time, although it's more commonly that it does. If you experience any allergy type symptoms, so you're getting hives, itchy, red, wheezy, sneezy, anything like that, you need to get medical attention immediately and do not take it again, because typically what will happen, even though it might not end up in full anaphylactic shock on that first occasion, if you persistently take it, that's likely where it's going to conclude for you.
I think the important point here is to see your practitioner. I mean, if nothing else drives this home, it is this example.
Yes, yes. Yeah, 100%. And I think it's, you know, because it is so popular, people rave about it. This might well be why your friend thought, oh, I'll give it another go and just see if it happens again. But medically speaking, that is absolutely not what our advice would be. But for those that can tolerate it, it makes an excellent choice for upper respiratory tract infections. There's been a number of double-blind clinical trials that have shown it reduces the symptoms of respiratory tract infections, including sore throat, mucus, coughing, runny nose. And, you know, this makes it a very powerful instrument when you're fighting off infection. And they now also understand that it improves antibody responses and also phagocytosis by macrophages, meaning you have a reduced risk potentially of secondary bacterial infections. And, you know, that's all kind of wrapped up in a beautiful bow of immune stimulation as well. So that's why it's so popular for the people who absolutely love it, because it works very, very well.
You know what? I'm going to ask our viewers out there to give their opinion between tableted versus liquid versions of Andrographis. Being the king of bitters, do they find actually that it has a better effect if they give it in a liquid form, albeit it's going to taste disgusting, And that's the issue I have. I have an aversion to it, a real physical aversion to it in too high a dose. But and I've normally got a cast iron gut, so it's really weird. But anyway, I'd love your opinion out there. What's your clinical opinion of the tableted versus the liquid herbs? I've got to say, although tableted versions are very popular and they have their place, I always think about, as you mentioned, the patient's symptom picture changing. And this is why I love herbal medicines in the liquid form so much, because you can change that formula as their patient picture changes. And I just think this is one of the beauties of liquid herbs for me.
Oh, I'm enamored with, you know, being able to personally formulate for people as well. Not to mention that, you know, from an energetic point of view, and I imagine a lot of herbalists would agree with me, the vitality in a tincture, there's a level of vitality that you can't get in a tablet. And look, I absolutely use and recommend tableted herbal medicines quite regularly, and they're great. But if I was given the exact same choice, tablet or liquid, I'd go for liquid, absolutely. They're also absorbed a bit quicker, which means you feel better faster. And in the case of infection, that's always a win in my book.
And if I had the option, I would always add a liquid formula to a tablet, so that at least I could vary this, you know?
Yeah, great. That's a great idea. Yeah, a wonderful way to administer that. And I guess, you know, we sort of covered those key things that are often selected for cold and flu. But when you're looking at the whole patient, when you've got a liquid formulation that you can, you know, craft for them, you can add other herbs that support lung repair, that work as expectorants, bronchodilators, and, you know, we've got a lot of great herbs to choose from, haven't we?
Well, indeed. And, you know, like being a fan of licorice and ginger, I've very often combined both licorice and ginger, and it certainly suits Erties. But what I love about ginger is that it gives that warming, soothing sort of feeling to the nasopharynx, but also helps in the dispersion of the herbs. What's interesting to me is something I found out about a little bit over a year ago, and that is that ginger talks directly to the genes of your microbes. Gut-based diseases, anyone? Gut-based respiratory infections, anyone? So it just, to me, it's really interesting how important some of these, you know, sidelined herbs are. And you don't need a lot of ginger. I mean,
no,
I would halve the dose normally recommended. Just put a little tiny bit in.
Yeah, 100%.
Anyway, so there's so many herbs to cover and there's so little time. What about herbs? Even two herbs that have got products on the Australian market that are of S2, that is pharmacist-only medicines, and that's Pelargonium and Elderberry. Let's talk about those for a tick.
Yes. Well, so elderberry, I guess in the context of taste, is the exact opposite of Andrographis. It's like a yummy little drink. And it's really popular for kids for that reason. And it's a great antiviral herb on its own. It's brilliant. But in the context of a well put together formula, it's just such a hero in there as well. And of course, it works very well in big kids too. But Pelargonium is another heavy hitter, although less extreme than Andrographis, which I would certainly look to employ, particularly when you've got chesty stuff going on. Wild ivy is another good one. And again, that's such a powerful cough herb, classic cough herb, that's often sold in pharmacies too as a single herb. But I'm obviously more of a fan of including those herbs in a formulation that, you know, does multiple things for someone. And can I just talk about for a moment my favorite herb to include for lung stuff?
Depends what it is. Of course you can.
So my favorite herb of all time, it's a pun coming here, is thyme.
Oh, right.
Thyme.
I was scrabbling there.
Sorry. That was so cringy. Sorry, guys, I couldn't resist. I've got to spice up the Tuesday somehow. Thyme is obviously a very popular culinary herb. It's something that I always include in my germ juice formulation, which is like another sort of cold remedy that I make for myself and clients. But the thing with thyme is a very rich source of thymol, which is a volatile oil or an essential oil. And all of the essential oils or volatile oils, when swallowed, are absorbed across the stomach lining just like alcohol, which means they get into the system very quickly. Now, obviously, anything that we ingest is metabolized in some way, and oftentimes is moved out of the body through phase 1 or phase 2 or phase 3 detoxification. And in the case of thyme oil, it is metabolized and eliminated by phase 1 enzymes in the lung tissue. Now, what this means is it's then evaporated up and out and exhaled through the lungs. Now, naturopathically speaking, we recommend medicated steam inhalations quite regularly. Head over the, hot bowl of water, and we add in, anti-inflammatory or antimicrobial combination of essential oils, and then inhale them deeply into the lungs to soothe the tissue and also effectively disinfect the lungs, for want of a more sophisticated term. Now, when you ingest thyme as a herb, it's like this reverse, shower for your lungs, and you're actually exhaling thyme oil. You can smell it on the breath of anyone who's taken it. And, it's antitussive, so it soothes the respiratory tract, reduces spasmodic coughing. It's antimicrobial. It's also a very gentle bronchodilator, which we need when you've got, mucus clogging up your airways. And I just think it's brilliant. Now, if you're a mum or dad at home listening, you can simply add fresh thyme to your dinner meal, for example, or you can pour some boiled water that's cooled a little bit over it and make a thyme and manuka honey and ginger tea and achieve, a similar effect. I just think it's such a legendary plant.
That's really interesting about the inside out rather than just inhaling things. Okay, I'm sorry, I can't leave this one out. You're talking about your favourite. I'm going to talk about mine. Before I do that, the polls are in. That seems like it's a dead heat between tablets and liquids. Anyway, holy basil, something that I spoke to Professor Mark Cohen about, and we started off on one topic and ended off just talking about holy basil. And this has become a favourite herb of mine because it works on so many axes. It's not just an immune issue, but it's also an adaptogen, and yet it's very safe to use in infections. So let's talk about that just for a minute. We've only got 9 minutes, or 8 minutes to go, so we better hurry things up.
Yeah, tell me your initial thoughts.
Well, the thing that I like about it is that it's not just an adaptogen, but it's also a great immune modulatory herb. It also has mood altering effects. So it works on this sort of 3-way axis, probably more. I'm probably being oversimplistic. So that it helps in the sickness syndrome. It helps recover from infections and inflammation, but it also helps stave off future infections as well. It's a beautiful herb. What got me about Mark, and I've tried 3 times now to grow the damn herb, and I must have got bodgy seeds. Nothing, not one thing has grown. So I have to try again, because Mark talks about having this as sort of a mini gift, like a little plant that you can gift to people. I love that notion of giving this sort of beautiful herb that you can give to people, and they can just take 2 or 3 leaves and chew on them. Quite safe. Absolutely. Make sure you've got the right plant. It's just this lovely immune gift that you can give to your friends.
Well, and this is the thing. This is where, it comes down to using food as medicine as well, and you can empower patient thyme, garlic, ginger. You can empower people to implement and include these things as well as everything else they're doing. And something like holy basil, you can chop up finely and put through stir fries, or you can use it through salads. You can then use it as a tea. It's actually readily available as a herbal tea from the supermarket, either on its own. I've got one in combination with ginger, cinnamon, It's almost like a bit of a chai, and it's beautiful, warming, astringent, perfect for this time of year. So it's certainly a great herb. Obviously, lung tonics have their place. Certain herbs like golden seal are really powerful as well. Elecampane and mullein are popular for lung support. And there's also a few specific ones you might drop in based on symptomatology. So, wild cherry bark for hacking coughs. You might look at for dry, tickly coughs, things like marshmallow. Or if you've got something that's more chesty and heavy, then wild ivy would be perfect too. And herein lies the beauty of obviously personalized medicine when it comes to herbs. And what that means, as you said before, often when you get sick, the symptoms you have at the start can shift a little bit through the process. And the support you might be getting at the beginning, your needs are different, 4 or 5 days down the track. So it allows you as a herbalist to actually really tweak things to support someone, almost on a day-to-day basis, or certainly on a week-to-week basis, depending on how they're presenting.
There's so much more, obviously, to cover. Really quickly.
Yes.
What about lymphatic herbs? Now, we haven't even discussed medicinal mushrooms, which I really wanted to discuss. So I'm going to ask now. Sorry, guys, but this is from me. Would you be amenable to coming back and having a part 3 of supporting our immunity if we discuss medicinal mushrooms?
For you, Andrew, of course. I would never deny you that. I know how much you love them, and you've got some really incredible personal experience with them too, which I know everyone's going to love hearing about. Yeah. So yes, let's park that for next time.
Cool. Okay. So lymphatics.
Yeah. So in closing, lymphatic herbs. So the lymphatic system, there's a number of different roles the lymphatic system plays in the body, but in one sense, it's a bit like the sewage system of the body. And it's such a terrible way to put it because it does such an incredibly important job. Yeah, right. But anytime it's overloaded or your immune system is weighed down, you can see problems show up there, and that can be in lymphatic congestion, which presents any number of ways, but some common presentations in the context of what we're talking about is things like tonsillitis, swollen adenoids, things like that. And if that's what's showing up for somebody, there are some very specific herbs that are excellent traditional choices to address those things. And you don't necessarily have to go to a herbalist for these things. Like, for example, cleavers is readily available. You can buy it in a herbal tea from just about anywhere. You can make even a cold, what's the word? It's not an infusion. Well, yeah, I guess it's a cold infusion. You can even finely chop it and use it in salads and stir fries. But cleavers is one of those herbs you can use to really help to clean out the lymphatics. But as a herbalist, probably my favorite one is poke root or Phytolacca americana. Now, this is not something that you should, if you're not a medical herbalist or a naturopath, you would ever self-administer because the therapeutic index is very, very low. A tiny bit is really good, and a tiny bit more could potentially be lethal. And so this is something that should only ever be dispensed by someone who's trained in it. However, it is a potent little herb that is really traditionally used for pockets of infection of any kind. Now, naturopaths have used it for things like boils, tonsillitis, dental abscesses, anywhere there's like this tiny little trapped pocket of infection. I love it for acne, cystic acne for that reason. It just really helps the immune system to clear that out a little more efficiently. But when it comes to respiratory tract infections, you can see tonsils and adenoids become inflamed and swollen and congested. And that's where I would think of using herbs like that to support the patient to recover.
Yeah, poke root's got a bad rap because in nature, where particularly those in Europe used to go out onto the hillside and have a picnic and pick some poke root, the Phytolacca, forgive me, I thought it was Decandra.
Well, there's several, there's several different
species. So the problem is that some of the constituents of the herb can vary by like a factor of 10 or 20. So
Yes.
do you get the small amount of the emetic, or do you get the massive amount of the emetic? And it's landed people in hospital. So therefore it's got a bad rap. But when you're talking about a herbal medicine that's got many plants mixed into one, into one mark and to one fluid extract from that mark, then obviously that's going to be balanced out. Now, I take the point about safety, but I mean, certainly, you know, there is a leeway that is allowed, if you like, with professional oversight. But, you know, one herb we didn't cover, and that is one of the adaptogenic herbs or adaptogens, Astragalus.
Oh, yes, we have to talk about that.
We need to cover this because there's a lot of myths. Now, we've got 1 minute left. Please, guys, forgive us. We are going to go a little bit over because we would like to include you in a couple of questions. But just a quick little thing about Astragalus, because there was this myth that went round about never using it in an acute infection. And I think that's this Western bastardization of an extremely complex system of medicine, the TCM.
So, yes, so Western herbal medicine and traditional Chinese medicine have a lot in common, but also there are certain applications that are quite different. And excuse this truck going past, can you hear that?
Only mildly.
Was I still on mute? Oh, great. Sorry, everyone. So what I was saying about Astragalus is there is evidence that shows Astragalus increases white blood cell production. Now, we know in times of good health, if you do a white blood cell count, there is a reference range that's considered to be healthy and normal. And it's very natural and normal and healthy that when a pathogen presents itself, whether that's a virus, bacteria, fungi, protozoa, parasite, whatever, we'll see a particular type of white blood cell count go up, which tells us, oh, that person's battling a virus right now, or a bacteria, or a fungal infection. And so the thinking behind saying you shouldn't use it in acute infection is in that initial immune response where the white blood cell count is greatly upregulated. We don't want to be sort of adding fuel to the fire, especially if the body's doing the job properly. However, the immune system can get a little worn out, just like we talk about adrenal fatigue, we can talk about immune fatigue, and we can see an initial rise in white blood cell count go up. But then if the immune system fails to get on top of the infection and we start to see leukocytes dying off, we start to see that cell count come down and we see a weaker and weaker immune response. And so I think there's a place for it in managing infection during acute infection, but I wouldn't personally use it in that first initial few days, or maybe even in the first 5 to 7 days. Now, if someone's not at least 50% better in that first week, I would then go, all right, their immune system is actually struggling to get on top of it. And it's at that point that I would personally go, I might just actually help support that white blood cell production now, because whatever they've got right now is not getting on top of it. And therefore they need a bit of an extra boost. Now, every clinician has to make their own call. Every clinician has to look at the evidence for themselves and decide what they're comfortable with. But having looked at the evidence for myself, that's where I sit as far as the use of Astragalus goes. Do you have any strong feelings about that?
Well, so looking at the very small amount of data that there is on Astragalus with viral infections, it's really interesting that it helped to stave off upper respiratory tract infections. My point, I guess, is that it is an adaptogen and therefore should only be used in those places where the qi is depleted or the qi is depleted. But if they are depleted and they have an acute episode, that's okay to use an adaptogenic herb. They are depleted. So don't, I think we've got to get away with what's acute and chronic versus the patient. We've got to always think about the patient.
Yeah, and it's always about looking at the person, and that's what makes naturopathic and herbal medicine very different.
Yeah.
You know, you're not, whilst you're trying to support that person with whatever condition or disease or illness or infection that they have, ultimately who you're looking after is the person that the condition has, not the condition that the person has. And that's where the skill and the subtlety has to be applied alongside whatever science can share with us as well.
In explaining what we see. That's really interesting. Okay,
Yeah.
Amie, thank you so much for taking us through this is a very hurried podcast because this is seminars, not just one. Seminars. This is indeed learning. I mean, this is where we learn. So thanks so much for taking us through some of the important herbs that we can use in supporting our immunity today. And of course, teaming that up with some of the nutrients that we can use, again, to support the patient in what they present and how they can recover from illness. Thanks so much for joining us today. We're going to be taking a few questions. We've got a little bit of extra time. We're running over time, I know, but if anybody's got some pressing questions, now's the time to ask. Otherwise, we'll wrap up.
Yep. Awesome. And I'm not sure if I did say this at the beginning of the podcast, and if I did, I may as well reiterate it now anyway. The way I view my prescribing protocol is nutrients first, herbs second, because even though herbs, of course, contain trace levels of all kinds of nutrients, when you're using nutrients for a therapeutic purpose, the herb can only do so much on top of a body or cells that are nutrient, replete. I guess, deficient. Well, not nutrient replete.
Right, I see what
you mean. And so, you know, let's say, for example, Echinacea increases white blood cell activity. Well, if the white blood cells don't have enough vitamin C on board to do their job, well, then you're not actually, the end result isn't going to be what you desire. And this is why it's best to use a combination of things that are really specifically chosen for the person that you're looking after. I'll just have a quick look down here. I think there was a couple more questions about dosage for NAC. It really does depend on the patient as well. But a starting dose is typically 100 to 200 milligrams. As a clinician, I have used higher doses, much higher doses, especially if they are, you know, very congested, having trouble breathing through the nose, having trouble coughing anything out of the lungs. Certainly, you know, 800 to 1,000 milligrams is not outside, you know, a normal recommendation. Thyme, look, with thyme, it actually depends on the, first of all, it's quite small, but it also depends on what ratio of the tincture you've got. If you're using a 1 to 2 versus a 1 to a 2 to 1, for example. So I can't sort of give you an exact dosage for that, I'm afraid. But it would work out to be probably 10 to 15% of the overall formulation if you're using a concentrated form.
It's a pretty strong tasting and smelling herb. So
yes.
You know, I mean, I use it in smaller amounts. I've never used it as a first, like, massive herb.
Sure.
Echinacea normally my one, and, you know,
you
ginger, marshmallow. We never spoke about marshmallow, but anyway.
Yeah, marshmallow is great, sore throats and that dry
wild cherry cough. If you've got a cough, a dry cough. And I'm not adverse to mixing herbs. Like some people might have an aversion to, say, mixing wild cherry, which is used for a dry cough. So something that you might want to inhibit versus something that an expectorant like elecampane or licorice was something that you want to help move things, or even indeed thyme. So I'm not adverse to combining those things, because often you can get this thick mucus which you need breaking up. You've got a dry cough because you've got this, if you like, exposed nerves. Certainly, you know, as I say, you change that formulation as the patient moves through their condition, you know, particularly in post-viral cough. That's just horrible to deal with, you know.
Yes, it's awful. There's one last question here from Helene that I'll answer. I'll squeeze in before you wind me up. She's asked whether wrap it up, gong me off. She's asked whether we would recommend taking a mixed immune herbal tincture all the time, or just when something is coming on and if constantly at a lower dose. Again, it depends on the herbs that you've chosen. So there's something to be said. So herbalists, there is sort of a category or an arm of herbal medicine where you might make up a constitutional tonic for someone, and you might tweak that week to week, month to month, season to season. And in winter time, if you know someone is prone to chesty things, you might actually set them up with what you would call a herbal immune tonic, which might indeed have a very low dose of astragalus, some lung tonics. But certainly in terms of the immune stimulating herbs, unless you're at a high risk occupation, I'm not a fan of those being taken constantly, even at low dose, although again, there are exceptions where that might be appropriate. So this is where you've got to ask your practitioner for very personalized advice.
Yeah, sure.
But there are indeed herbs and herbal formulations that are designed to specifically support your immune system, even when you're well, so that it's just slightly more ready. And this is actually where medicinal mushrooms come in. So I would really hope that you'll tune in for episode 3, where we talk about that, because that is actually really an immune modulatory symphony of plant compounds that allow your immune system to be highly tuned and serviced, if you like, ready if something shows up. So certainly the nutrients would be my primary recommendation, but there are some other things you could consider.
Yeah, I think with herbs, I don't have a contraindication to using immune stimulating. I have an issue with that term, but anyway.
Sure.
Immune stimulating herbs long term. My only question is, as the clinician, you should be asking the question, why does that patient need these? And addressing that, i.e. adaptogens, NutriChart. I mean, is it an iron deficiency? What's going on? Do they have a hereditary deficiency of secretory IgA? What is going on with that patient? We should be looking at their neutrophil counts. We should be assessing what's wrong with them and making a professional decision based on that evidence. But Amie, thank you so much for joining us once again, and we certainly look forward to chatting with you in part 3. This is going to be an ongoing thing, I can tell, but in part 3 where we'll be discussing, amongst other things, medicinal mushrooms. Thanks so much for joining us today on FX Medicine.
Catch you then. Bye.
This is FX Medicine. I'm Andrew Whitfield Cook.